double sure it's, there it goes. All right, so it started recording, Jeremy. So yeah, thanks for your time and thanks for jumping on. So my understanding is you guys are moving off of CPS side in Meditech, right?
Correct, yes.
What version of Meditech are you guys going to?
Expanse.
Okay. So with Expanse, and this conversation, obviously is geared around materials management, right?
Yes.
All right. So what I'll do is I'll introduce myself, especially since this is recording and others will be watching it, do introduction. Lisa do introduction, and if you'll do an introduction as well, that'd be great. And same thing with you, Ted. So I'm David Dean. I'm the president, CEO of ACS MediHealth. We've been around for 38 years, and supporting Meditech for 29 of those 38 years. And so we support Magic Client Server, 6X, Mass, and Expanse. And we do it globally. So we've got office in the US that supports all of North America. And we also have an office in Dublin, Ireland that supports UK, Ireland, and other areas that Meditech participates in. Lisa?
Good morning. I'm Lisa Hahn. I'm the solutions consultant for ACS MediHealth. And I will be your first point of contact and then support along the way with any projects you may have going.
Thank you. And Jeremy?
Yeah, I'm Jeremy Bishop, so I am a supply chain consultant with MedSR. So I'm here on site helping out with POS as they go through their implementation into Meditech.
Excellent. And Ted?
Good morning, afternoon. I'm Ted Camerano. I've been with Meditech pushing 27 years now. My actual title now is an integrated architect. Worked with David way back when he was first getting into the handheld game with Wendy Ballou and his program he had there. It's good to see you still have here, unlike me. But yeah, I've been around for ages, and I'm very familiar, obviously, with the handhelds and everything else.
Yeah, so one of the things, Jeremy, as we're looking at it, and especially since you guys are moving to Expanse, is with the materials management product, we typically do what's called an ET40. And that ET40 is a handheld tablet, basically looks like an iPad. And with that does have an integrated barcode scanner. It's part of it. It also has a 10-inch screen. It's actually semi-rugged, meaning it can take a 4-foot drop to concrete multiple times on all edges, surfaces, yada, yada, yada. Basically, it's a very durable product that you can use in the clinical space. So with that, this particular product does have healthcare grade plastics that's on it. So you can clean it with any kind of solutions that you would like. So whether that's Cavi, Sani, 10% bleach, purple top, but you name it, it doesn't matter. You can wipe these units down in a different area, especially as you're going in rounds in different wards or, surgical services or wherever else you may be going to using this particular tablet. So for that, in the past, what typically has happened is there's a handheld device that on this handheld device was a third-party application, which we developed and another person developed as well. And you'd end up having to load your inventory on that particular handheld device and then go do your scanning and go back to a docking station, dock it, and do what's called an HHT transfer back into Meditech. Then Meditech would then take that data and then populate, in the appropriate fields, et cetera, so it can degradate the items that were scanned. It can, look at creating requisitions, and then, of course, hitting materials management for requests for product to be delivered to whatever area. So to simplify that, because there was, obviously as a third-party vendor and having vendor applications, there's support and application costs and all that kind of fun stuff. We took all that away about 6 or 7 years ago. We're doing it through a tablet. So what you see on the screen here is a tablet. It's 10-inch screen, has an integrated barcode scanner that's part of that. So you would open up your Meditech MM session on the web. So you'd open it up through Chrome. And so as you go into Chrome, you'll be prompted to put in your credentials. I'm gonna put mine in. Do you also, while I'm doing this, do you know if they use single sign-on at La Paz?
I believe they're going to, yes.
So single sign-on obviously would prevent having to log in your credentials all the time, et cetera, et cetera. So as they log in, this is just because this is the marketing ring that you're seeing. What they would be prompted to do is to go in probably to something that looks like this. From here, I'm just going to drop down to materials management, and then I have materials management that pulls up. So bottom line is what you see on your desktop and what the users will be used to using from a desktop perspective is the exact same view and feel that you'll have on the tablet. So there won't be, different training that has to take place from one to the other. It's the exact same workflows, the exact same processes, et cetera. So whether you're doing an exchange cart routine or patient issues, inventory, whatever it may be, all of that is readily available on the tablet that you can literally click through and do your processes or whatever it is that you would like to do. And so as you're doing those, obviously you're looking at creating those scans. It automatically degradates in real time. And once you're done doing your scans or, patient exchange, whatever it may be, or patient issues, and you save it, it immediately is put into the system. It immediately sends, if it falls below your threshold with regards to number of products on hand, then it'll send a requisition over to purchasing, but it'll also automatically send a pick list to materials management so they can start that process. So there's no basically back and forth running from floor to floor, from the basement to, third floor back down to the basement whenever they do their scanning. So there's no, what do we call it? There's no, storing of data on this device because you are using it on the cloud with Meditech. So everything is done in real time. Does that make sense?
Yeah, perfect sense.
Okay.
Yeah, this is outstanding, David. And Jeremy, I think, correct me if I'm wrong, because I'm doing several sites at once.
Yeah.
But you did speak with Steve Holmes's group also, which is true just handhelds.
Yeah.
Yeah, correct. It was exactly like what David was saying earlier, where they have to send the file and you dock it.
Right.
This seems like this would be cutting out the middleman. This is seems like a way simpler process.
No question about that. And I did a hospital a couple of years ago, not to jump in on you, David, but Unity Hospital in just outside of Arkansas in CSC grabbed the tablets. They did it all without me even knowing it. We had a great consultant on site. And next thing I know, they're up and running with it. And that's where I got my first glimpse in the real time. God, I've been looking for this for 20 years. You know what I mean? This is what every customer wants.
Absolutely.
It is. It's in, and I'm ecstatic about this right now. So
we
just wanted to put that
assisted
out
them.
there.
I was just gonna say we actually assisted them with those tablets, Ted.
Yeah, and I didn't even know it. You had Dave McClintock on site. And next thing you know, Dave's telling me that he's got it up and running. I'm like, when the heck did that happen? I was just there. So, yeah, no, that's fantastic. So, and Jeremy, we can certainly discuss some of this off the line, but I just wanted to throw that 2 cents in there as well.
Yeah, and Jeremy, truthfully too, we've got so many sites that are using this solution that if La Paz wants to have somebody to talk to about it or, talk to a reference site, whatever it may be, we're more than happy to provide those references for you so that us can reach out to them to see how they use it, what the success they've had, et cetera, et cetera.
Yeah, that's great. That's always good to know you can talk to somebody that's already using it.
Yeah, for sure. And one of the things that we really want to look at too, so when are they getting application delivery? Do you know?
They're already getting it. We've done our trainings. Did we do end user? We did end user just a couple of weeks ago. So we've done just about all our trains, and we're working on something right now, Dave, just so you know, with the whole patient issue by location or from location.
Gotcha.
The nurses and how they're going to do it out of PCS and nursing.
Yeah.
So I think, and Jeremy, you can correct me if I'm wrong, but I think Christine will really like the handheld feature and being able to jump into this piece of it for that part of it we were talking about yesterday.
Yeah, I agree.
Okay, that's good.
Yeah.
So one of the things we can do, Jeremy, and with the team with La Paz is to provide them with a demo device, and that demo device doesn't cost anything. We'll send them a device, and basically it's a eval agreement and tell them not to send it back in a Ziploc baggie. Other than that, they can use it however they want to use it. So we're more than happy to get a device set up, get it configured, sent out, and then they can actually test with it so they know what they're purchasing, what the feel of it is, how the workflow is going to be, et cetera, which certainly gets buy-in at that point because they're physically using it in their test environment, doing these different routines.
Yeah, I think that'd be very helpful.
Okay, that'd be perfect. So we'll be more than happy to do that. Should we just send you the eval agreement, and then you'll forward on to whoever it goes to?
Yeah, you can just send it to me and then I'll copy everybody. That's fine.
Okay, perfect. So we'll get that. You'll get the email from Jamie Slider, who's on our side of the house, but she'll send over an eval agreement for an ET40, and then we'll get you set up and running and all that good stuff.
Okay, great.
With that too, I know we're focusing on materials management, and Ted touched a little bit about nursing as well. I guess one of the questions I have is, are they also looking at point of care nursing and phlebotomy handheld for mobile devices as well?
I'm not sure what nursing is looking to. I know they're gonna have like bedside scanners for wristbands and those type of things.
Yeah.
I don't know about far as like Ted was saying, doing the patient chargeables, how that's gonna work yet. So that may be an option for them though, because they could like say just be able to sign in and do it real time. So that might help them as well.
Yeah, with the handheld mobile, and that truly is a handheld mobile device, much like you've seen in the past, but it's called the HC50. It's by Zebra as well. The HC50 is a handheld mobile device. It's 6-inch screen. It allows them to do a badge tap to log in, which presses credentials in. They can access point of care nursing where they can do med administration. They can do assessments. They can do INOs, you name it. Basically, they can see most anything and everything from a workflow perspective instead of having to either push a WOW around or have a PC in the room. It can augment some of that workflow so that they're more efficient. And then you can also tie in unified communications. So you get your nurse call alerts, your phone, your PBX tied to it. You can do your secure messaging, texting. There's all kinds of stuff that you can do so that basically what we're trying to do is take as many things out of the tool belt as possible by creating one device that can do all things. So that's just something to think about as well as you guys are moving through the project.
Okay.
Cool. So if you're good with this, we'll get the ball rolling on our side from an eval perspective. We'll have that agreement sent over to you and you can forward to whomever else. What we do ask is as soon as they receive the tablet, give us a call. We'll get our tech guy on the phone. His name is John Wiggert. Get him on the phone. He'll do any other little setup that may need to be done on site just to make sure that everything is working appropriately. And then they can go at it, go scanning, go testing, go do whatever.
Sounds great.
Okay, cool. Any other questions?
I don't believe so. I appreciate your time today.
No, absolutely. And I'll take this video, obviously, since we're recording it, and I'll shoot it over to you as well.
Okay, that'd be great.
Excellent. Thank you, Jeremy. Thank you, Ted, for jumping on.
Thank you.
Yeah, thanks, David.
Thanks,
nice
Ted.
seeing you again.
Yeah,
Thank
likewise.
you, Lisa. Have a
Thank
great
you.
day.
All right, see you guys.
Bye-bye.
Bye-bye.
Take care.
Bye.